Hello and welcome everyone. Today we are discussing about Wilms tumor. Wilms tumor is also known as nephroblastoma. It is a most common pediatric renal cancer. It is a most common pediatric abdominal cancer and it is a fourth most common pediatric cancer overall. It is seen in children of 5 years or less. The tumor is named after German physician Dr. Max Wilms, who first described it in 1899. Etiology. The cause of Wilms tumor is unknown. Certain genetic alterations are associated with Wilms tumor. They are WT1, CTNNB1 and WTX gene alterations. They can be found in around 35% of Wilms tumor cases. Other alterations are TP53 mutation and MYC-N. WT1 is a tumor suppressor gene located on the chromosome 11p13.1. Another gene that is called WT2. It is located on chromosome 11p15 and it is found in the patients with Beckwith-Wiedemann syndrome. Wilms tumor is thought to develop from persistent metanephric tissue or nephrogenic rests. Certain conditions are associated with this tumor such as hemihypertrophy and iridia and variety of urological disorders such as cryptorchidism, horseshoe-shaped kidney and hypospadias. Wilms tumor is associated with number of specific syndromes including WAGR syndrome. WAGR syndrome refers to presence of Wilms tumors, aniridia, urogenital abnormality and mental retardation. Other symptoms associated with this tumor include Dennis-Dresch syndrome, Beckwith-Wiedemann syndrome, Sotos syndrome, Perlman syndrome, trisomy 18, Frazier syndrome, Bloom syndrome, Lee-Fraumeni syndrome, Simpson-Golabi-Behmel syndrome. Now let's learn the symptoms of this tumor. Tumor present as an asymptomatic abdominal mass. Other symptoms include abdominal pain, gross hematuria, urinary tract infection, varicocele, hypertension or hypotension, fever, anemia, and if patient has a lung mets, then dyspnea or tachypnea. How to diagnose this condition? First, check for complete blood count to look for anemia. Renal function test, urine analysis, coagulation studies, cytogenetic studies to look for 1p16q deletion and imaging studies for mass analysis such as renal ultrasonography, chest x-ray to look for lung metastasis, abdominal and CT scan and abdominal MRI. Histopathology. Grossly, the Wilms tumor are usually well circumscribed and have a pseudocapsule. Wilms tumors include triphasic pattern on microscopy. The triphasic pattern shows blastemal component, epithelial component and stromal tissue component. The blastema is the most undifferentiated and most malignant component. It consists of collection of small, round, blue cells with very active mitotic activity and overlapping nuclei. Epithelial component can demonstrate wide variations, ranging from early tubular formation with primitive epithelial rosette-like structure to differentiating tubules or glomerulo-like structures. The stromal component may include densely packed, undifferentiated mesenchymal cells or loose cellular myxoid areas. Treatment. The treatment of Wilms tumor is usually nephrectomy followed by systemic chemotherapy. Staging of Wilms tumor. Stage 1. This indicates tumor was completely contained within the kidney without any breaks or slippages outside renal capsule and has a no vascular invasion. Stage 2. Tumor that has grown outside the kidney to some degree, such as in the surrounding fatty tissue. Usually, tumor would be completely removable by surgery and regional lymph nodes are negative. Stage 3. The cancer has spread to regional lymph nodes but not far. Cancer has grown into nearby vital structures, so it cannot be surgically removed. Deposits of the tumor are found in peritoneum or there are positive surgical margin. Cancer cells were accidentally spilled into the abdominal cavity during surgery. The tumor was removed in the separate pieces surgically, such as one piece from the kidney and another from adrenal gland. Renal biopsy of the tumor was done before it was surgically removed. Stage 4 tumors are those that have spread through the vascular system to distant organs such as lungs, liver, brain, bone and distant lymph nodes. Stage 5 are those cases where both kidneys are involved with the tumor at the same time at the initial diagnosis. So this is in short about Wilms tumor, and these are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.